Hello and welcome to YouTube channel Health Q, the place where my mission is to motivate you to look at the brighter side of the health. You all must be wondering what I'm doing with so many things on this table. Yes, this video is for people who are stroke survivors. Remember in my previous video, I talked about something called as CIMT, oral constraint induced movement therapy. Today, I'm going to give you some ideas, some inspiration to do CIMT or else constraint induced movement therapy practice at home to improve hand functions. These activities will give you a general idea as in how simple and easy these steps are, how practically you can do these things at home, and with repeated practice, how much improvement you can achieve. So, want to get some inspiration how to do CIMT for hand at home? Make sure to watch this video till the end. Let's begin. So as you can see on this table, I have got some props. So the most important thing that I will need for CIMT practice is a sock. For CIMT practice is a sock. So basically this sock will act as an constraint or else something that will stop my good hand to come into the picture. You can use a mitt, a cloth, a crepe bandage, etc. Apart from that, I have taken some things like a book, a mug, a box, some straw, a ball, and some shells to do my repeated hand practice. Now, the aim with which all these things are going to be used here is to promote hand functions. All of the tasks that I'm going to do in today's video will mimic some or other activity that we do with our hand in day-to-day life. So, in order to do this, first of all, let's constrain the hand. Consider my left hand is affected and I want to give therapy to my left hand, then I will constrain my right hand. So, I'll just wear a sock to stop this hand to come into the picture. So this sock will actually remind me that I'm not supposed to use the good hand and I'm encouraged to use the affected hand. So let's start with the first and the most easiest activity, which is lifting off some things like this and putting it back. So I'll just show you the first activity. Let's keep other things aside. Alright, so I have this bowl full of shells. So the task which I'll start first is trying to pick individual shell and put it down. You might find doing this initially difficult, but it's okay. The more time you take, the better would be the movement. So don't focus on the quantity of movements, but quality of movements. At the same time, finishing the task. It's okay if you are progressing slow, but even a small progression every single day matters. So you will just slowly take out all the shells from this jar and keep it on the side. So this way you are activating your shoulder muscles. So these shells are of different texture and different sizes. So this allows me to hold and grip things in different ways. Some are big, some are small. So that's a good way to change the intrinsic activity of fingers. So as you can see, I have nicely gathered all of them. Now I will again start picking it up one by one and putting it back down. If you feel that your hand gets tired, feel free to take some break. But again, start doing the task. And encourage yourself not to take help of the other hand. So this forms activity number 1. Let's move on to activity number 2. So for activity number 2, I have got 2 things. One is the ball and another one is the mug. So the activity which I'm going to do here is, I'm going to lift the ball, try to hold it, leave it inside. Then I will hold the mug and then pour the ball down. Same way, I will again try to hold it, put down, hold the mug and then pour it down. So this encourages 3 activities. One is my spherical grasp to hold an object. The second, the release of the object, which is also impaired in stroke. Third is a folding grasp or is a hook grasp. Fifth, rotation of your shoulder. And then sixth, again picking it up and holding. So this is again a very good task to be practiced throughout the day. So this forms activity number 2. Let's move on to activity number 3. So activity number 3 requires little thinner items where you are trying to pick things and lift it up straight this way. So this activity involves wrist movement up and down. So in order to do this, again I will take this mug. So in order to do this, again I'll take this mug. I will pick the straw and place it inside. Again I will pick the straw and place it inside. Again I'll try to hold, lift. This causes my elbow bending and then wrist bending. Lift and then down. Again lift up and then down. Lift up and then down. Try to do this again repeatedly to encourage movements. Again down and again up. So this form activity number 3. Moving to the activity number 4, this is opening of the box. This could be little difficult task, so you can do this depending on your ability. If you find doing this difficult, you can skip this task and move on to other tasks. But here what you're trying to do is you're trying to dig your fingers inside and then open this thing. And then again putting this precisionally and again putting this with precision and then pressing it down. This looks very simple to be done from a normal person's perspective, but a stroke survivor will definitely find this difficult. So keep on trying until unless you succeed. And then press. Again lift up and then press. Again lift up and then press. So this forms activity number 4. Now let's move on to the last activity, which is taking the help of a book. Here in this you are trying to open and move the pages of a book. So you will just hold a page and just try to move back. Again hold a page. You need to pull your fingers and then move your page. Again hold and move. Hold and move. Hold, move. Hold, move. Hold, move. Hold, move. Hold, move. Hold and move. This is one activity that you can do with the book. Second activity that you can do again is also with this thumb. You are just trying to move the pages this way. I'll show you from this side. Holding the fingers, pressing your thumb, and just try to do this. This also encourages the hook grasp or a pincer grasp. This also encourages the grasp of the hand this way. Like this. And the last activity that you can do with this book is simple, and that is practicing of writing. So all you need to do is just you need to grab a pen and just practice writing something with this. So this will encourage your finger or pincer grasp, or where you try to hold a pen or pen grasp. So again, try to write something. This way. Isn't it simple? Friends, in stroke rehabilitation, it's very important that you do your repetitions very consistently and in a motivated manner. I understand that there would be plateau, there would be time where you will be frustrated without getting any results. But please don't give up. Continue doing your practice again and again. Slowly, different neuronal pathways will develop in your brain and you will see results. So, on that note, I'll end this video here. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.